Hello, my name is Brian Casey, Editor-in-Chief of AntMini.com, and we're here at the 2016 edition of the RSNA meeting in Chicago. We have with us right now Dr. Jay Bronner. He is President and Chief Medical Officer of Radiology Partners. Dr. Bronner, thanks for being with us today.
Pleasure, Brian. Thanks for having me.
Yeah. So there's been a lot of challenges facing radiologists and radiology practices in the last few years. What are some of the major trends that you see happening?
We see that as practices have taken advantage of the efficiencies that they've gained with PACS, there's a harder for them to grow without developing more robust infrastructure. For example, areas of creating clinical value, areas of information technology, areas related to revenue cycle management all require a certain amount of infrastructure, and practices that were not really interested in partnering with other practices a year ago now express real interest, and we're very much impressed by the change that internal forces as well as external forces in imaging and healthcare has brought about.
What are some of the external forces that are requiring radiology practices to kind of re-examine what they're doing?
I think the whole transition from volume to value has created incentives and have proved to be challenging for practices that don't have access to large databases where they're able to data mine clinical information. So that has been something which has promoted some of the advances in clinical value creation. Also, having large databases allows you to do significant research and significant trends analysis of how we can add value for reducing variability in the way people practice and become more engaged and better partners with primary care doctors as we get more involved in active patient management.
Okay. Now, there's definitely been a big shift away from volume-based care toward value-based care that's being driven by, in the U.S., by Medicare, Medicaid. Do you feel that most practices are well prepared for that, or is there going to be a big learning curve for them?
I think there's a learning curve, and I think it's a real opportunity for radiology to improve the position of the specialty in healthcare. For example, we have, as a practice, Radiology Partners, we have access to north of 5 million interpretive reports a year, and that number is growing. That gives us the ability to data mine information where we can see what are the best ways to make specific actionable recommendations for very common findings that drive cost, but also impact outcomes, and something that our referring physicians really are looking for. Even in this month's article, Journal of Radiology, Dr. Zafar, in an article called Chasing a Ghost, talked about how frustrated sometimes primary care physicians are just by the fact that they're not able to use the technical information and the clinical information that we as radiologists are promoting. So the ability of a practice to adopt the best practice, reduce variability on specific recommendations, as we have, for example, with our thyroid nodule project, have really impacted both care, costs, and improved our specialty's position.
Okay. So another issue that seems to be developing is this one of radiology needing to make their reports maybe a little more understandable for referring physicians, a little less hedging, a little more direct. Is that something that you think that the radiologists should change their approach a little bit in how they're reporting findings?
I think it's very local. I think if there's a practice based at a university setting where we're dealing mostly with subspecialists, they know that subspecialists understand the underlying diseases and they understand the underlying recommendations. Lots of places, however, our examinations are referred to us by nurse practitioners or physicians who are more primary care based, internal medicine based, and may not have subspecialty knowledge. So actionable reports is something that referring physicians are really looking for so that they can maximize the value that they get from the radiation and the cost of the study.
Okay. Any other things that you're seeing here at RSNA in Chicago that you feel like exemplify some trends that are going on in the radiology industry right now?
We see a real interest in injecting ourselves into accountable care organizations and groups that manage risk and manage care. And as a radiologist, some of the primary diseases that are being managed by ACOs are not heavily radiology based. And therefore, it may be hard for radiology to grow and to develop the data and the best practices in those areas. So there's a need within the specialty right now for us to own this own the process of developing best practices and to develop uniform recommendations where they make sense, and really then be able to contribute to the growing accountable care organizations that are starting to form and composed of physicians of all backgrounds and all subspecialties.
All right. Well, Dr. Bronner, thanks for being with us today.
Pleasure. Thank you.
All right. Signing off for AntMini.com, this is Brian Casey.